When it comes to the Affordable Care Act, or as many call it, Obamacare, there are no shortage of questions and confusion. Joining us now to help us answer some of the most commonly asked questions is Vince Spinelli, a licensed agent with Health Markets. Good morning. Welcome back.
Carly, good morning. It's so nice to see you again.
I love having you on the show because I know so many people are Obamacare and certainly everything that goes along with it. We're now, what, in its second year?
Yes, this is the second enrollment period.
I think it's just as confusing as what it was, 12 months ago.
Just as many questions.
Yeah,
just as many
so
questions.
Let's tackle some of these most commonly asked questions. And I think first and foremost, I think what people really need to understand is there's help out there. You guys are ready to help and clear this confusion for folks.
Well, that's a very good point. As a matter of fact, the Naples paper just 2 days ago made exactly that point on the front page. People have questions, and they don't know where to get the questions answered. And at Health Markets, we have trained, unbiased agents that are not attached to any one particular insurance company that can answer their questions and can assist them with their application. And all of those services are provided without a charge.
I was just going to say the best part is it's free. So
free.
The first question I think people have is there somebody out there who can help with this process, help with the application? The answer is yes.
Yes.
So easy enough. You can call your office, meet with somebody in person.
Over the phone, in person, whatever is convenient, just to get started.
Okay. Second question I think people have when they get down to the nitty-gritty, they think, oh, this is kind of expensive. Why is it so expensive?
Well, that's a tricky one. First of all of the insurance rates have gone up because the Affordable Care Act requires insurance companies to accept everyone regardless of any pre-existing conditions. So that means that in order to cover healthy people, the rates are set to cover some of the most difficult insurable people in the past. So that can be offset if a person can earn a tax credit or a subsidy. But otherwise, if they cannot earn a tax credit or a subsidy, the rates are approximately 200% of what they were before the Affordable Care Act.
And that leads into our next question about subsidies. I don't even think I realized that there were subsidies available, but you can help people see if they qualify for a subsidy?
Absolutely. Matter of fact, that's just the way we start the process. We determine based on their family size and based on their income for the insurable year, whether or not they're going to qualify for a subsidy. Once we have that information, we can proceed to help them to pick the right product. If they don't start that way, they go to the healthcare.gov, they start putting in their name and their address, they're in the dark, they don't know what the destination is, they get to the end, and all of a sudden they're told what their credit is going to be, and they have to pick a policy within 2 or 3 minutes. It becomes very challenging.
I'm getting stressed out just thinking about having to do it. And by the way, subsidy meaning, I mean, the government, there is essentially money that they will apply for. That's what that subsidy means.
Actually, again, based on the income and the family size, the client can pick any policy that they want. Many people think they're fixed into 1 or 2 different types of policies. The client can pick anything from a bronze to a platinum. But the tax credit stays the same regardless of which one they pick. So they're going to get that $250 or $400 or $600 a month, regardless of which size policy they pick, and the government mails it directly to the insurance company.
You were telling me one of the other misconceptions in the commercial break is about people assume that it's just one government plan.
Correct.
And I was even asking you, I know last year Blue Cross Blue Shield was I think the only carrier last year
in Collier County. In Lee County, there were several others, like Aetna and Cigna. But last year it was Collier alone through the exchange, which, as we discussed, means that in order to get a tax credit, you have to go through the exchange. This
so there
year,
are different options this year.
This year there are more options.
Assurant,
which uses the Aetna Signature Network, and United Healthcare are also in the exchange for those people that are eligible or want to apply for a tax credit.
I also want to mention deadline coming up here soon for those who have not enrolled. Maybe they already have enrolled and think they may have, done it incorrectly. There's still time to fix it. What's that important deadline that we want to hit?
The last deadline, we've had December 15th, January 15th last night, and February 15th. So February 15th is the last day to enroll for this year, for
Okay.
2015. At that time, enrollments can be taken to correct previous
Okay.
mistaken or errors, or to start a new application.
Yeah.
Okay.
So remember, that's the important date. We're running out of time here. February 15th. The take home here, there is help, right? Don't try to
Absolutely.
tackle this on your own. Call today.
Absolutely.
Meet with somebody.
We'd be glad to help him.
All right, there's the number right there, and then certainly email. You said you had something you wanted to send an email to if people send you an email.
Anyone in the audience would like a very, very quick explanation of Obamacare, the income levels, and the essential benefits that are required, get to my email, vince.spinelli@healthmarkets.com.
Easy enough. Thank you so much
Thank
for
you,
what
Carly.
you do and helping
Thank you
clear
so
up
much.
this confusion for us.
It's
We
always great to
appreciate
see
it.
you.
Yep.
Take
We'll
care.
send it over to Steph.
It's giveaway time. Today we are spreading the love. Be the second and fourth person to call 239-673-3388 to receive this basket of goodies. It's including a Blu-ray copy of The Best of Me. And then you're also going to get a limited edition wine glass and a Blue Apron coupon to receive, get this, a customized meal delivered right to your door. Now you can't win if you have already won something with us over the last 90 days. Good luck. Up next, how you can feel and look beautiful without the downtime of surgery or the pricey products.